Hello everyone. So today we start a new topic that is oncology system. So in oncology system there are many topics. So first one is chemotherapy. So let's start chemotherapy. So in chemotherapy there are some chemo medicines also. So in chemotherapy, first of all, the all chemotherapy anti-cancerous agents are high alert medications. So in chemotherapy, all anti-cancerous agents are high alert medication. These all medications are high alerts. So first, that one is the side effect, some like bone marrow suppression, anemia, thrombocytopenia, okay, pancytopenia, and next one is vomiting and nausea, like okay, then alopecia, stomatitis, elevated uric acid, and always check temperature every 4 hourly. So these are the some side effect of the chemotherapy. Like first one is vomiting and nausea, second is alopecia, hair loss, and third one is stomatitis, and fourth one is elevated or increased uric acid level. And next point is always check temperature every 4 hours. Okay, so there are some more side effects like dry mouth, so you have to give artificial saliva. Next is bone marrow suppression. This is the most important side effect of chemotherapy, that is bone marrow suppression. Okay, so there is in bone marrow suppression there is low WBCs count. So we have to put the client on neutropenic precaution. So in bone marrow suppression there is low WBCs, that is decreased number of WBCs. So we have to provide or put the patient on neutropenic precautions. So what is neutropenic precaution? This is the most important question as compared to or in nclex exam. So what is neutropenic precaution? In neutropenic precaution, we have to provide provide room, provide in neutropenic precaution, provide private room with door closed. So in bone marrow suppression, there is decreased number of WBCs. So we have to put the patient on neutropenic precaution. So in neutropenic precaution, we have to provide private room with door closed. Next point is change bed linen every day. So next point is fresh fruit and fresh flour. This is the most important point as compared or in the point of nclex exam. So the fresh flour and fresh fruit fresh fresh fruit or fresh flower, and gardening is not allowed. It is not allowed in chemotherapy. Okay, so we do not give the patient no uncooked food, no undercooked food. Do not give uncooked food and undercooked food. Next point is hand washing for at least 20 seconds. Hand washing for at least 20 seconds. So there are more points like there are no pets allowed in chemotherapy. So limited visitor. Okay, limited visitor, and the visitor are not allowed more than 30 minutes. During chemotherapy, limited visitors and the visitors are not allowed more than 30 minutes. Not more than 30 minutes. So in bone marrow suppression, there is WBCs, low WBCs. So we have to put the patient on neutropenia precautions. So in chemotherapy, the fever is a priority. Fever is a priority over 100.3 Fahrenheit. Fever is a priority over 100 over 100.3 Fahrenheit. So in chemotherapy there are some more point like we have not allowed the visitor like a pregnant woman, right? The pregnant women are not allowed in a chemotherapy. Ill visitor and child less than 18 years. Pregnant woman and child less than 18 years and ill visitor or sick patients are not allowed in chemotherapy. So we have to allow the visitor with personal protective equipment. Okay, so and also you have to check the regular temperature. Even slight increase in temperature, that is medical emergency in chemotherapy. Okay, so and also some more points like no give live vaccine in chemotherapy and avoid invasive procedure. Okay, and shower once a day, brush twice a day. Okay, and after brushing, put brush in damp hot water, and private washroom and clean washroom at least once a day. This is also an important point. Like private washroom, you have to provide the patient in chemotherapy private washroom and clean washroom at least once a day. And in chemotherapy, there is one more point, like we have to change dressing every other day. Okay, and also check ANC count, that is absolute neutrophil count, so every day. So more than 500, that is normal ANC count. Okay, and one more important point in chemotherapy. So till 48 hours after chemotherapy. Next point is till sorry, my cursor is not working, so I will repeat an previous one. So we have to check ANC count, that is absolute neutrophil count, every day. More than 500 ANC count is normal. Okay. So next point is till 48 hours after chemotherapy. Till 48 hours after chemotherapy, we consider all secretions as cytotoxic. Okay. Till 48 hours after chemo, consider all secretions as cytotoxic. Consider all secretions as cytotoxic. Consider all secretion as cytotoxic. Till 48 hours after chemotherapy, consider all secretions as cytotoxic. So, like secretions like blood, urine, saliva, vomiting, stool. And not a single visitor is allowed. Okay, not a single visitor is allowed. 100% private room and separate laundry strictly. We have to provide 100% private room and separate laundry strictly. And the next point is we have to provide balanced diet to the client. We have to provide balanced diet. Give them food at room temperature. And in balanced diet, like we have to give high protein as well as high potassium diet. Okay. In balanced diet, give them a food at room temperature, and we have to give high protein and high potassium diet to the client. So next point is in chemotherapy, monitor for sore throat. In chemotherapy, if a patient having symptoms like sore throat, so it is the infection sign. Okay, it is the infection sign of infection. And there is another one, next or a point, in vomiting in chemotherapy. If a patient having vomiting, so best medicine is antiemetic, that is ondansetron. So if patient is feeling nauseated, the next point is if patient is feeling nauseated and vomiting, is feeling nauseated and vomiting, nauseated and vomiting while chemotherapy, while chemotherapy. So first step, being as RN, we have to stop the chemo. If patient is feeling nauseated and vomiting while chemotherapy, so an RN, so we have to stop the chemo, then flush the NS. We have to stop the chemo, then flush with NS, that is normal saline. Flush with normal saline, and all in this time we have to give ondansetron to the patient, that is antiemetic, best medicine for the vomiting, that is ondansetron. Then we have to flush with NS, then start chemo. Okay, flush with NS, then start chemo. Okay, so there is also some more points, like give soft and pure or easily digested foods, and rinse their mouth with NS or water after every meal. So we have to rinse their mouth with NS or water every meals. So if the patient having alopecia, we have to use cold ice pack on head, scalp, and before chemo give them choice of wig and educate them to the use scalp tourniquet. Okay, and if patients having anemia or if having shortness of breath, so give them O2 therapy. Okay, and also give iron rich food and erythropoietin injection. So and also there is more point, like if patient having thrombocytopenia. Okay, so in thrombocytopenia, like we have to apply a bleeding precautions and wall precaution. And next one is chemo medicines. First one is doxorubicin. Okay, what is doxorubicin? So doxorubicin is the reason for cardiomyopathy. Okay, so in doxorubicin, it affect the heart. Chemotherapy, there is chemo medicines, so some medicines are, first one is doxorubicin. So doxorubicin is the medicine that affect the heart, or it affect the heart, and also it decrease the insulin sensitivity. It decrease insulin sensitivity, that is hyperglycemia. In doxorubicin is the reason of cardiomyopathy. So main side effect, that is it affect the heart and decrease the insulin sensitivity, and that is hyperglycemia. So fever is the highest priority over 100.5 Fahrenheit. So in doxorubicin, fever is the highest priority over 100.5 Fahrenheit. Okay, so how to remember about the doxorubicin? So it affect the heart, this is the main point, and fever over 100.5 Fahrenheit is the highest priority. So next medicine is, in chemo medicine, the next medicine is, I will discuss about the first medicine, that is doxorubicin. It affect the heart and fever over 100.5 Fahrenheit is the highest priority. Okay, so Next medicine is cisplatin. 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 This drug comes in chemo medicines, that is chemotherapy medicines. So in cisplatin, it is a nephrotoxic and ototoxic drug. It is a nephrotoxic and ototoxic drug. Ototoxic. The simple mean is it damage the kidney, and ototoxic means hearing. Okay, so advise patient to report if there is any feeling of tinnitus. If there is feeling, report if feeling tinnitus. So what is tinnitus? Tinnitus is a ringing sensation in ear. What mean by tinnitus? It is a ringing sensation in ear. So we have to advise the patient if there is any feeling like tinnitus, that is ringing sensation, we have to report. Okay. So cisplatin, before giving this drug, the next point is, before giving this drug, we have to check the creatinine level of the patient. We have to check the creatinine level of the patient. So more than 1.3 creatinine level of the patient. If there is more than 1.3 creatinine level, so we have to hold this medicine. Okay. In cisplatin, it is a nephrotoxic and ototoxic drug, and we have to advise the patient if they feel any tinnitus, that is ringing sensation of the ear, so we have to report. And before giving this drug, we have to check the creatinine level. If the creatinine level more than 1.3, we have to hold this drug. Okay. And if there is, so we have to monitor urine output. So if urine output is less than 30 ml, we have to hold this medicine. And we have to educate the patient to increase the fluid for 3 days if we give this medicine. So that's all in cisplatin. So next medicine is cyclophosphamide. 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 So this medicine is also comes under in chemo medicines. So it disturbs the menstrual cycle, that is period cycle. Like it disturb it disturbed menstrual cycle, and this drug is also cause hemorrhoids. Cyclophosphamide, it disturb menstrual cycle, and this medicine also causes hemorrhoids. And there is one more point. So in cyclophosphamide, it can cause bone marrow suppression. Okay, so we have to put the patient on neutropenia precautions, like you already know. So next medicine is vincristine. VANCRISTINE. vincristine. This is also comes under in chemo medications. Vincristine. So this is the only drug in vincristine. It is also important as under an nclex exam. This is a important medicine, so we have to remember or learn. This drug do not suppress the bone marrow. This is the only drug which do not suppress the bone marrow. So there is no effect on RBCs, no WBCs, there is no effect on platelets. Okay, there is no immunity, there is no risk of bleeding. But vincristine is a neurotoxic. Sorry, it's my mistake. So vincristine is a neurotoxic. So it damages nerves. So we have to educate the patient, to immediate report if there is numbness, tingling, sensation, and ataxia, that is balancing problem. So we have to educate the client or patient to immediate there is if there is any numbness, tingling sensation, and ataxia, that is balance problem. So we have to report. Okay, so in vincristine there is one more point. The main side effect is in vincristine the main side effect is constipation. Okay, so vincristine, this drug do not suppress the bone marrow, so it is a neurotoxic, so it damages nerves. So we have to report if there is numbness, tingling sensation, and ataxia. So main side effect is constipation. We have to give the high fiber diet or 2 to 3 liter water and stool softener. So next medicine is tamoxifen. 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 In tamoxifen there is 3E. We have to remember, like in tamoxifen 3 E's. First E stand for estrogen. E stand for estrogen. Second E stand for emboli, that is clot risk. And third E stand for endometrial cancer. Okay, so in tamoxifen, this is the number 1 drug for breast cancer and endometrial cancer. This is the best or number 1 drug for breast cancer. Sometime in nclex they ask about this medicine. So which is the number 1 drug for the breast cancer or endometrial cancer? That is tamoxifen. Okay, so in tamoxifen it leads to clot formation, emboli, like so we have, or we do not give in DBT or pulmonary embolism. So here is some contraindication. We do not give in a DBT and pulmonary embolism because it lead to clot formation. So we do not give this medication in DBT as well as pulmonary embolism. So there is one more point. red face and hot flushes are red face and hot flushes are normal. Hot flushes are normal and expected with this drug. Okay, so in tamoxifen, E stand for estrogen, E stand for emboli, that is clot formation, and E stand for endometrial cancer. So this is the number one drug for the breast cancer, and there is some contraindication like DVT and pulmonary ambulance. We do not give this medication because of it lead to clot formation, and red face and hot flushes are normal and expected. Okay, so one more drug is that is the drug is oprelavicin. 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 So this drug increases platelet level. Oprelavicin. This drug increases platelet level. Okay, so this drug increases platelet level, so there is risk for the anaphylaxis and afibrillation. So give with chemo drugs to reduce the thrombocytopenia, and increases only platelet, no RBCs, no WBCs. Okay, give with chemo drugs to reduce the thrombocytopenia. Okay, and increases only platelet level. There is no increase in WBCs or RBCs. Okay, that is the oprelavicin medication. So here is one last important point in nclex. This is the most important point, so you have to learn or you have to remember. In oncology system, almost 99% drugs are avoidable with grapefruit juice. In nclex, almost 99% drugs are avoidable with grapefruit juice. We do not give or we avoid with grapefruit juice. Okay, so here we start next topic. This is the most important topic in nclex, that is radiation therapy. Okay, it given in combination with chemotherapy. The next topic is radiation therapy. So it given in combination with chemotherapy. So it of two type. Radiation therapy having two type. So first one is teletherapy. Radiation therapy having two types. So first one is teletherapy. And second one is brachytherapy. Radiation therapy having two types. The first one is teletherapy and second one is brachytherapy. So teletherapy is also known as or also called as external beam radiation. Teletherapy is also known as or also called as external beam radiation. Okay, so now we discuss about teletherapy in detail. Okay, that is external beam radiation. Okay, so let's start. In radiation therapy, first type is teletherapy, that is external beam radiation. So, in teletherapy or external beam radiation, the therapy source is in outside the body. Teletherapy is like the source is outside the body. Okay, so with teletherapy, the number one side effect is with teletherapy, the number one side effect is skin irritation. Skin irritation and exhibit symptoms like burn. So we have to educate the patient, avoid oil, cream, lotion, and shape the area. So no perfume. In teletherapy, the source is outside. So number one side effect is skin irritation. So we have to educate the patient to avoid oil, cream, lotion. Do not shape the area, and no use of perfume. No perfume. In teletherapy, the patient only wash with in teletherapy the patient only wash with educate the patient only wash with mild soap and water. So in teletherapy is also known as external beam radiation. The therapy source is outside. So with teletherapy, the number one side effect is skin irritation. So it exhibits symptom like burn. So educate the patient about do not use or avoid oil and cream, lotion, shade. Do not shape the area. No perfume. So we have to educate the patient about like they use or wash with mild soap and water. So in teletherapy, the next point is educate the patient to pat dry the area, do not rub. So never rub that area, only pat dry. Okay, educate the patient to pat dry that area, do not rub. And some more points like only soft cotton cloths are recommended. In teletherapy, only soft cotton cloths are recommended. Only soft cotton cloths are recommended. And some more points like cover the full body while going out, and no use of like no tanning bed. Educate the patient to do not remove the marking, like okay, and do not apply heat or cold therapy. There is also a point like do not apply heat or cold therapy. Do not apply heat or cold therapy. And there is one more point, that is instruct client to do not move and do not change position while on teletherapy. Okay, that's all in teletherapy. Okay, so next type is brachytherapy. So in brachytherapy, we have to implant the cesium for 24 to 72 hours. So in brachytherapy, the source inside the body. Okay. In teletherapy, the source is in the outside the body, and the brachytherapy, the source is inside the body. In brachytherapy, we have to implant the cesium for 24 to 72 hours. So brachytherapy is mainly used for female reproductive cancer like endometrial and cervical cancer. Okay. So some principles for brachytherapy. Okay. First principle is we have to provide private room and private washroom to the client. Private room and private washroom to the client. Educate client to stay in one position. Okay. So also there is one more point, like provide them cluster care. No direct contact for more than 30 minutes for staff. We have to provide cluster care, all care in one time. That is cluster care. So no direct contact for more than 30 minutes. So if RN is not providing care, if RN in brachytherapy, if RN is not providing care, so maintain at least a 6 feet distance. Okay, in brachytherapy, we have to maintain the distance that is 6 feet. Okay. So in brachytherapy, we have to apply dosimeter all of the time by staff. That is TLD meter, dosimeter. In brachytherapy, we have to use dosimeter. So here's some more point about the dosimeter. That is TLD meter. Dosimeter we have to use all the time by staff. So best location for dosimeter is in brachytherapy. Best position or best location of dosimeter is upper pocket facing toward patient. Upper pocket facing towards patient. This is the best location of dosimeter. And we have to provide private room and private toilet, and doors should be closed all the time. So we have to instruct the patient to flush the toilet at least 3 times after using the washroom. Okay, this is the also important point. We have to instruct the patient or the client to flush the toilet at least 3 times after using the washroom. At least 3 times after using the washroom. So here are some more points, like no care provided to patients and lower body, especially in brachytherapy. So always wear gloves, and in brachytherapy always wear lead apron while performing direct care, and educate client to never touch the radiation source. This is the also point. This is the also main point. Okay. In brachytherapy, we have to flush the toilet at least 3 times after using washroom. And some more point, like always use a long lead handled instrument. Okay. Always wear gloves. Always wear lead apron while performing direct care. So never touch the radiation source. Or Always use a long lead handle instrument and put the equipment in lead container and call hazmat team. If there is any uh, fall or spillage of radiation source, we always use a long lead handle instrument and put the equipment in lead container and call hazmat team. So so more points. More points like no pregnant staff and radiation therapy client. Okay. mm, no pregnant staff with radiation therapy client. So also there is a sign on door that is mandatory, like caution radioactive. Sign on door that is caution radioactive. Pregnant women do not deal with the brachytherapy patient or a client or radiation therapy client. So some more points are, we have to put the sign on door that is mandatory, caution radioactive. And one more point is, body emits 7 to 14 days radiation out, so avoid direct care for 2 weeks at least. So up to 6 months of distance for pregnant women and child up to 12 years of age, avoid contact. Okay. And there is also a point, transport the laundry in black polythene and with doubled packing and airtight, that is separate laundry. So body emits 7 to 14 days radiation out. Okay. So avoid direct care for 2 weeks at least. Avoid direct care at least 2 weeks. Up to 6 months of distance for pregnant women. Up to 6 months of distance for pregnant women and child up to 12 year. So avoid contact. Okay. Child up to 12 year. There is separate laundry, so transport the laundry in a black polythene and with double packing and airtight. So some side effect like in brachytherapy or that is premature menopause and vaginal dryness. There is side effect that is premature menopause and vaginal dryness. That's all in brachytherapy. So next topic is lymphoma. What is lymphoma? Lymphoma is a cancer of lymph nodes, and lymphoma also known as secondary WBCs. Lymphoma is a cancer of lymph node. Also known as secondary WBCs. Secondary WBCs. So lymphoma having two types. First is Hodgkin lymphoma. Second one is non-Hodgkin lymphoma. First one is Hodgkin lymphoma. Second one is non-Hodgkin lymphoma. So what is lymphoma? Lymphoma is a cancer of lymph nodes and also known as secondary WBCs. There are two type of lymphoma. First one is Hodgkin lymphoma and second one is non-Hodgkin lymphoma. So in Hodgkin lymphoma, the first point is in Hodgkin lymphoma, it occurs in early age of patient. In Hodgkin lymphoma, it occurs in early age. It occurs in early age. And in non-Hodgkin, it occurs in old adult. It occurs in old adults. I repeat it. This topic, lymphoma is a cancer of lymph node. There is two type, Hodgkin lymphoma and non-Hodgkin. In Hodgkin lymphoma, it occurs in early age, and non-Hodgkin lymphoma it occurs in old adult. So next is second point is Hodgkin lymphoma, cancer in upper body lymphoma. Where is cancer? There is upper body lymphoma, like under neck, under armpit, under armpit, upper chest. Okay, in Hodgkin, cancer in upper body lymph like under neck, armpit, upper chest. Okay, so in non-Hodgkin cancer, in non-Hodgkin cancer is all throughout the body. All throughout the body. I repeat the second point. In Hodgkin lymphoma, cancer in upper body lymph under neck, arm, armpit, upper chest. So in non-Hodgkin, the cancer and all throughout the body. Here is some more point in Hodgkin lymphoma. The third point is the Hodgkin lymphoma has good prognosis. In non-Hodgkin lymphoma, it has poor prognosis. Okay. That's all in Hodgkin lymphoma and non-Hodgkin. But some more points that are more important in nclex. This is the more important. So mark as a star. Okay. So in Hodgkin lymphoma, there is Reed-Sternberg cell. Reed-Sternberg cells are present. But in non-Hodgkin lymphoma, Reed-Sternberg cells are absent. This is the important point. So in Hodgkin lymphoma, the Reed-Sternberg cell is present. In non-Hodgkin lymphoma, the Reed-Sternberg cells is absent. Okay. The main cause of lymphoma, both Hodgkin and non-Hodgkin, the main cause is Epstein-Barr virus. Epstein-Barr virus. This is the cause of lymphoma, both Hodgkin and non-Hodgkin. That is Epstein-Barr virus. Okay. So here we go next. There is some sign and symptoms in lymphoma. So I will explain one more time lymphoma. What is lymphoma? It is a cancer of lymph nodes, also known as secondary WBCs. There is two types of lymphoma, that is Hodgkin lymphoma and non-Hodgkin lymphoma. So in Hodgkin lymphoma, it occur in early age, and in cancer in upper body like under neck, armpit, upper chest, it has a good prognosis. And in Hodgkin lymphoma, there are red stonework cell present. And the in non-Hodgkin, it occurs in all adults, and the cancer all throughout the body. And non-Hodgkin has a poor prognosis, and red stonework cells are absent in non-Hodgkin. So some signs and symptoms are in lymphoma. First one is painless worms and lumps under arm. Painless worms and lumps under arm, that is axillary part. Painless worms and lumps under arm. These are the signs and symptoms in lymphoma. First one is painless worms and lumps under arm. Second one is enlarged lymph node and lymph glands. Okay, enlarged lymph glands. Next is fever with no chilling or okay. Next sign is weight loss. Next sign is night sweats. These are the signs and symptoms in lymphoma. And next sign is infection. Last sign is fatigue. So these are the signs and symptoms in lymphoma. First one is painless worms and lumps under arm. Second is enlarged lymph node. Third one is fever. Fourth one is weight loss. Fifth one is night sweat. And sixth one is infection. And last one is fatigue. So these are the signs and symptoms in lymphoma. So next we start next topic. But next topic we will start in next part. So thank you for watching this video.